Hey, hello everyone. Can you all hear me pretty well? Thumbs up or someone say yes. Thumbs up, awesome. So my name is Ethan. Nice to meet all of you. My name is Ethan. I'm the Region 7 Chair of PsychSIGN. The meeting today will just be relatively informal, just a way for residents to kind of talk about their experience with residency, maybe some tips or pointers on how they did their rank list and whatnot, and kind of just also some tips and pointers on what their transition was like from medical school into residency. So there's a few residents, all psychiatry residents, who may be joining at different points within the meeting, but just kind of looking at the participant list right now, we have Dr. Brian Hodge, Dr. Nish Patel, and Dr. Tyler Wheeler. I'm not sure if you guys all just want to introduce yourself really quickly and say hello and kind of let everyone know where you're completing your residency training.
Yeah, I could go first. Hey, what's up, guys? My name's Brian. I'm an intern right now at Zucker Hillside Hospital. It's a standalone psych hospital in New York. And I'm the former PsychSIGN president, so it's like cool to see you guys. And everyone else, and former PsychSIGNers, Nish and Tyler, what's up?
Hey everyone, my name is Nish. I'm one of the interns at University of Louisville. Like Brian said, I was also in PsychSIGN former mentorship chair.
Yeah, and I'm Tyler Wheeler. I'm a PGY3 at UCLA Kern Medical, which is a community-based hospital program in Bakersfield, California, so like Central Valley, California.
Awesome. And if any of the other residents log on at any point, I'll keep a lookout on the participant list and make sure that they know to introduce themselves and give input where needed. So I guess just based off of the timeline and where we are right now within the residency application process, I'm not sure how many PGY4s are currently on the call right now, but for those who are not PGY4s, kind of February, a lot of interviews seem to be coming to an end at this time, and the rank list just opened about last week and it closes on March 2nd. So just because of that timeline, I was hoping to maybe kind of start the discussion just talking about rank lists in general and see if the three of you have any pointers or tips on kind of how to go through your rank list and how to create your rank list, specifically in psychiatry.
I can talk about a couple of things that I learned while I was making a rank list and didn't occur to me before this list opened up. So the biggest thing for me was thinking about where my family was. So residency, especially psych, is like 4 years, excluding your fellowship years. So that is a lot of time in your life. And as you go through residency, you may meet someone, you may get married, your parents are also going to get older, you want to be closer to your family. So that was one of the things that kind of took a bigger role than I thought initially, because at first I was like, okay, I want to go to the best program out of all the ones that I've interviewed. But best doesn't necessarily mean what is right for you. So that brings us to the second thing, which is how do you want to practice from after residency? Do you want to be outpatient? Do you want to be private? Do you want to be academia? Do you want to be at a hospital? Do you want to go to rural hospital to practice? So that kind of dictates where do you want to be as well. Because 4 years is a long time to spend somewhere, establish yourself. Everyone is going to know your name by the time you finish your residency. So that takes, that should be taken into account as well. So one would be like, for me at least, was family. Number two was, I want to be in a town that had the practice setting that I wanted to do. Like I mentioned, academic versus private versus outpatient clinic. And the third thing is, if you have interest in fellowship, then does the program has that fellowship or not? because fellowship is another thing where you go, people are going to know you, and after fellowship, you're going to start practicing. So it's good to have that roots established with patients while you're in training. And the last thing was work-life balance. There were some programs that I really wanted to go. They were very good, but the work-life balance was insane. The program director, not the program director, the chair of the program had told us that you would be working from 7 to 7. I was not going to do that. Absolutely not as a psychiatrist. I knew that I wanted to be home, waking up at 6 o'clock, going to work at 8, be home by 4, 3 o'clock. And because I have a wife, I want to have kids soon. So I wanted that good lifestyle balance where I can spend time with my family, also do other projects that I want to do, like get involved in community services. So things like that. So 4 things to cap that were important to me were being close to family. How would the residency help me transition to the practice that I wanted to after I finished residency? If they had any fellowships that I was interested in, and the work-life balance.
Yeah, so everyone, I guess, like sort of has their own like interests and priorities in terms of what they really want in a program. I think the most important thing is figuring out for you like what's most important in your life, and then sort of ranking it like Nish did. Say, hey, family's number 1, this is number 2, 3, and seeing, I guess, what program fits best with that. I think at this time, like last year, I sort of got caught up into thinking, oh, like just like I want to go to a big name, or I just care about like Doximity rankings and stuff like that. And at the end of the day, when I submitted my rank list, I was like, it actually doesn't matter to me. What really matters is, for me, is going to a place where they have like really chill people, really nice residents, cool program directors was like my priority. And I think during the interview process, both whether it's just during the interviews, or maybe like some post-interview communication, like recruiting, or like if you ask to, I don't know, have a second look or ask follow-up questions after the interview, and even just like a response shows to me that, hey, this is a cool place. I like these people. They're gonna like care about me. I think that was the most important thing for me, is seeing how much a place would care about me, how much and how much they're caring about me beforehand, before I am actually a resident there, might show, might translate to how they treat me when I'm actually a resident. So that was, like my priority number 1. And there's of course a bunch of other stuff like environment, patient population, the general like the stuff that the program has, like different types of electives, different opportunities, research, all that stuff. It's going to be different for everybody. There's not sort of one clear answer, I don't think. Again, I think it's really just prioritizing, hey, what do I like? What do I want in a program? How will I feel the happiest, most comfortable during these 4 years? And then, will it help me later on in life too? I think in general, most programs are going to give you a good training. Most programs are, like have that really good curriculum. And of course, there's standard things that all programs have to have according to the ACGME. So I think, it's really about finding the sort of minute, fine details and determining the differences between the program. For me specifically, I came from New York. I, grew up here. I mostly wanted to stay here. I did apply to some other places like in California and stuff. But, it was sort of tough trying to figure out the differences between the New York programs, specifically the New York City programs. And at first, I was like, oh, like I said, it's all about the big name. So I liked NYU, Columbia, at Cornell on my list as well. But at the end of the day, I actually ended up ranking them lower than my program right now, Zucker Hillside. And it's because of all those reasons that I said before. The vibes were just there, Yeah.
Yeah, so I agree with what these guys both have said. At the end of the day, it's going to be very much a personal decision, and it's going to be, depending on your life circumstances and your priorities, kind of how you weigh the variety of different factors that go into this decision. At least for myself, I really prioritize geography. So a bit about myself, I did my medical school training in Canada, and then kind of followed my wife, who is from California, down here, so that she could kind of complete her education. And so I knew that I wanted to be as close to her as possible. And so I really prioritized California-based programs. And then other things that were important to me were patient population. So I'm interested in kind of community psychiatry, public psychiatry. And so making sure that I had a community-based population, a population that had a lot of high needs, and what would kind of offer me that complexity that I would be able to have in my training environment. That was an important factor. And yeah, I think at the end of the day, I imagine it's probably a little bit trickier for you all, since I'm sure a lot of your interviews happened over Zoom, but also just kind of getting a sense of, can you picture yourself in that hospital, in that kind of day-to-day setting with those residents and those attendings for the next 4 years, because that's going to be the reality of the next stage of your life. So just kind of making sure that you can at least mentally picture yourself in those programs, I think is a big factor as well.
Thank you all for that. Those are all very pertinent points, and I think definitely beneficial things to kind of take into consideration when creating your rank list. I guess just in terms of timeline, something else that I just wanted to discuss with you. I'm not sure specifically if this is anything that either three of you did, but in terms of letter of intent, do any of you have any recommendations, whether personally or even talking to co-residents or other colleagues or whatnot who did submit letters of intent during their residency application process?
So I'll preface my response by saying that I'm on a little bit aggressive side. Not really a rule follower. I do what I felt right for me because I was a student and I wanted to match. I was spending a lot of time on those Excel sheets. People are like, hey, no, you just submitted the rank list. You got to wait for 2 weeks, let them review application. I did that, and I wished I had not done that. The reason being is because I noticed, just talking to program coordinators and just from the experience after the fact, when I sent out 12 or 14 letter of intent. So I think you should do that within the first few days, because especially the way the application process has shaped, they are really looking into, number one, to programs are looking for application number ones based on the scores and their overall general application, like number of research experience, shadowing experience, volunteering experience. Second is, some programs were truly, they had literally told me after I had sent them LOI that they were interested in people who are reaching out to them, who were interested in their program. So what I did is whichever states or programs I was really interested in and had some connections, I sent letter literally directly to the program director, and I CC'd the program coordinator. And I did 12 of them, and I got 6 additional interviews afterwards. Some even put me on waiting list. So obviously you can't just say, hey, your program looks really nice, I'm very interested in going here. I would love an opportunity to interview now. you got to give them a reason why they should pick you. In addition to kind of personal message also helps. For example, many of the programs were in the state that I had family. So I wanted to be closer to family. I mentioned that. And I also want to establish in a community that I'm going to live in. I also kind of let them know that as well, that I kind of want to stay there after I'm done with the program. I'm not going to pick up bags and bounce. So those things kind of help them. And I think that's one of the reasons why they gave me 6, or why those 12 or 14 LOIs gave me additional 6 interviews. So I think you should start within first few days, reach out to the program coordinators, definitely CC program directors, 100%, because the same program director was also on Twitter who found me and offered me an interview. The program director had also personally emailed me that someone will reach out to me to schedule an interview. So don't hesitate to do that, because if you follow what the people say on Excel sheet or anyone else, that's on you, because you're a student, you're trying to match, you just spent 4 years, a lot of money that you don't have in this thing. And if you try to play safe and you don't match, you can't blame anyone else for that.
Yeah, at the end of the day, it's really all up to you. I'll put a caveat on this by saying more of the opposite. I'm like too, almost a little bit too relaxed about it when I was in this season. Another caveat is that, I also got at least like somewhat of a glimpse of both the application and the interview process. And with that, I also got to see, what the matching is somewhat like, sort of the initial phases of it, because I was able to interview at my program and then, interview current M4 students who applied to my program and assist at least in the ranking of them. So, in the beginning of the application process, there's, the letter of interest, which I think Nish was referring to, where you can say, hey, I'm really interested in your program and it's because X, Y, Z, whatever, and include, coordinator and the director in that. And that, can definitely boost your chances of getting interviews. I didn't send any, to be honest. It was mostly because I felt comfortable with the amount of places I applied to and, the type of places I applied to. Could it have, increased my sort of, the amount of interviews I got? Probably, actually, to be honest. I feel like there's a chance that, reviewing the applications, for program directors and everyone else involved, it's a lot to go over. It's a lot of pages, each application. When I was going through them, it was like 40 pages each, and I was like, wow, this is a lot. So there's going to be always those whatchamacallit, just like different things that program directors use as a cutoff to sort of screen out applications. And you might be, in that process of, of people screening you out, unfortunately, in the beginning of the year. And, sending out letters of interest can, increase your chances of you not getting overlooked, basically. But I think at this stage, for the M4s, it's sort of about, letters of intent. And usually, actually, I suggest sending them pretty much, as soon as your interview season is over, when you're really confident in where you're going to score each, or where you're going to rank each program, and say, hey, I really like you. I think I'd be a great resident here because whatever, XYZ. I think we had, I really liked your residents. I really liked your program directors, all that stuff. And this is the stuff I want to do at your program, all that. So that's, your letter of intent. Whether it changes your actual ranking in the program, that's nobody knows, to be honest, except the actual program director, the person that's receiving that email, right? Will it hurt your chances? No. Especially if you're sending it to your top program and telling them that you're their number one. It can get dicey, I think, a little bit when it's not your number one program, and you're just generally saying, hey, I really like you, I'm maybe ranking you highly or something like that. But you never know until you shoot your shot. So yeah, at the end of the day, in summary, I guess I think it's it'll be really important to send out that letter of intent to your number one program for sure, especially if you feel like it is like a reciprocal relationship, they really like you, you really like them. I think that's like when the match process really works.
To add on what Brian was saying, yeah, definitely don't send out like 10 of them saying you're my number one. I can guarantee you that program directors do know each other. They do speak to each other. Some program directors, they even kind of run their list by each other if they know the applicants. So they could be like, hey, this dude sent me number one too. Don't do that. Be honest with it. I never told any of my program I'm ranking number one. I just told them I'm very interested in their program. So try to be honest with the letter of intent, because psych is a small community. They know each other.
Yeah, and he ain't lying. Because I know, because like I was, president, like I said, and I was involved in ADPERT, which is the association of program directors in psychiatry in the U.S. And yeah, they definitely a lot of them are best friends. A lot of them hang out maybe on Zoom too, I guess. If they're far away. And yeah, they definitely do talk and talk about just the application process in general. So yeah, so I definitely be careful in terms of who you're sending it to and what you say to each one.
Yeah, I don't have a lot to add to that. This was, as far as my strategy, this is like 3 years and one pandemic ago. It's a little bit blurry in terms of how many I sent. But in general, I would just echo, make sure that the letters are personalized and come from a genuine place, whether that's commenting on something that came up, a discussion you had during the interview, or something in particular about the program that you think kind of uniquely speaks to you. And then be genuine. Don't tell everybody that you're their number one. But yeah, apart from that, I think I sent out letters to a few people, a few programs, but I obviously have no way of knowing whether or not they affected my chances one way or the other. So at the end of the day, I don't have much concrete for you.
Thank you all for that insight. I guess just the last kind of major topic before I open up the floor to see if anyone has questions that I kind of want to touch upon. More so, I guess, for Dr. Patel and Dr. Hodge, just because Dr. Wheeler, you're a little more detached in terms of time. But in terms of the transition from medical school to residency, how did the three of you feel that went, especially with Dr. Patel and Dr. Hodge having gone through all the virtual interviews and having that process a little more, I guess, online rather than in person, and not maybe potentially not even seeing your programs in person until the first day of residency?
So for me, I kind of knew what I was getting into, because like I mentioned earlier, that I'm kind of aggressive on my side. So I'm sure, well, I can tell you that I dug up on each one of my top 10 programs. I literally reached out to all my residents on those programs, spoken to them. Some of them even spoke to the program directors as a third year to get an insight into how the program works. So number one thing that I wanted to know was how is their work-life balance? Or in other words, not only the work-life balance, but how are the residents getting along with each other? How is the program? Are the program receptive of the residents, their feedback? Are they making any changes to it? So I figured that out through talking to residents a lot offline after the interview. And that kind of told me how it would be when I transitioned to become a resident, because I wanted to know whether they're supportive. And surprisingly, I had this thing built in my head that residency is going to be very ridiculously demanding. I won't be able to do this. I won't know how to do that. I'm like the person who turned the ant mole into a hill. So after I got here, it was completely the opposite. Because I had my checklist, remember I said that I wanted to know whether residents were supportive of each other, are the faculty supportive of each other? And that's exactly what happened with me, at least. My program was extremely supportive, including the chiefs. I could literally text chief saying, hey, I'm on IM rotation. I don't know how much Seroquel to give. Literally any dumb question that you would hesitate to ask. They laid out the foundation for us in a way where we were not hesitant to ask questions, including attendings. I even called the attendings in the past, and they actually encourage us to call them if we have any questions. So that was because I had kind of done my own homework and in anticipating how the residents are going to be for me. So that was worked out well for me. So you want a program that will support you. The second thing is you want the program that is receptive to residents' feedback, because that kind of tells when you start as a brand new intern, if you're having issues, how they're going to support you. For example, COVID. If you get COVID, how does that work out? Is it going to take your come out of your paycheck if you don't work, or is it going to take your vacation time? The information I already had from residents was that my program, at least, does not use vacation time, neither take away the pay. It's just you got COVID and you're off. So things like that. To answer your question, I think having a supportive program kind of helped a lot in terms of starting as a new resident, making me not feel like, hey, I need to use my chain of command, or use my upper level that's on the rotation if I can't read. To ask all the questions. Nothing, like pretty much everyone had given me their numbers to reach out to them if I had any questions at any time. So I felt the transition was made very well because of the program that I was in. I'm not sure if that answered your question adequately.
Definitely does. Thank you.
Go ahead, Tyler.
Yeah, so I think for me, like you said, it was a few years ago, but it's still, I think, sticks out in your mind. So, I think it's certainly a major transition point. It's always going to be, there's going to be some changes. You're likely going to be in a different location, different set of responsibilities. Hopefully you will have a supportive program and a supportive group of peers to help kind of ease that transition. But I guess, in terms of some of the things that stood out to me, just kind of the difference in mindset as far as the responsibilities go. You are now the one putting in the orders. You are the one that even if all of your decisions are ran by an attending and ran by a full team, you are still kind of the more directly responsible for your patients. So that does take a little bit of getting used to. In terms of like what I did to prepare for residency, I would say, after you match and that hurdle is over, I would try to use that time to just kind of rest and prepare yourself for residency. You may feel like you need to review all of your med school material, and power to you if you have the time and effort to do all of that. But I don't think it's really necessary. I might have reviewed some very basic psych material just to make sure that I didn't make a complete fool of myself on day one. But outside of that, ask your residents and ask the program once you're matched a little bit about what the onboarding process looks like. At least in my case, it was a very kind of gentle onboarding where we were all of the interns were essentially working on the same service for the first month. kind of slowly got introduced to the various systems and kind of the processes. And yeah, it was just overall very supportive. And so I think just kind of making sure that you go into it with a mindset that, even though it will be a lot different and there will be some challenges, that if you have a supportive program and a supportive cohort, then it should be a good transition.
Yeah, in general, it sounds like, the theme is that if you have a supportive place, it's going to be a nice transition. Mine was the exact same. I didn't do much in terms of preparation, in terms of like learning like more about my program after I matched, or even like studying or whatever, like Tyler said, because in general most of these things are not necessary. Again, I am more on the relaxed side, at least starting in like the M3 M4 year. Yeah, you really don't have to do much, to be honest. Of course you're gonna make mistakes, of course you're not gonna know like everything, but that's just part of the process. And I was fine, like getting things wrong. I think that's the most important part of intern year, is making these mistakes or whatever now, so that you learn later on in the future, and you could prevent mistakes from happening, you could teach others about them and so forth. And yeah, as you go along, your confidence like really boosts. Like mine already has a lot. I feel a lot more comfortable just doing anything, and just comfortable like being a doctor. I think like the weirdest thing was like people calling me doctor, which was something I was just like, whoa, what, really, me? Or like, or like something's going on with the patient, and they're like, yeah, the doctor has to fix it, and it's like, that's gonna be you. I'm like, oh shoot, that's me right now. I gotta do this, But I think like they said, with the right cohort, with good people supporting you, like at the end of the day, like it's not a terrible process in terms of transitioning from M4 to intern year. And we're all in psychiatry, we all care about mental health. So I think that's like something that most programs, I think most leadership of programs would actually care about for you. But don't forget to care about it yourself, in terms of taking care of yourself. Like you're finally gonna start making money, and I'm not gonna lie, that really boosts like your whole life. Like it makes a lot of things easier. Makes you, I think moneyness is happiness. It fixes a lot of problems. So you'll definitely be a lot more comfortable when you're a resident, just doing whatever you want to do. So yeah, in general, the transition, like, not too bad.
Yeah, and on that note of making sure that you keep yourself well, make sure that you continue doing those things that you enjoy doing, that got you through medical school, whether it's exercise, spending time with friends, family, any of those hobbies, any of those things that you do now for stress relief. Make sure that you find ways to incorporate those things into residency as well.
So to kind of add on that, I'll just echo that, yeah, definitely don't do anything to kind of like prep yourself for it, because there's some things you really can't find in the books. For example, assessment and plan. That's the meat, bread and butter for psychiatry, or as a doctor, in any specialty, that you're not going to learn. And there's no perfect antipsychotic for psychosis. You got to learn based on what the patient's needs and symptom side effects, their comorbidities are. So don't beat yourself about it and start studying as soon as you match. Definitely take the time off. I can tell you, looking back, because I studied, I can tell you it didn't help me as much as I thought it would have helped me. If anything, maybe just look over some drugs, but even then I wouldn't beat yourself about it. And most important thing to remember as a resident is, at least the first year, is to take it easy on yourself if you make mistakes. Speaking for myself, So because I was in the Army, I was in a specialty where I was not allowed to make mistakes. And that was 12 years of my life constantly being under microscope. So it was a big deal for me when I made mistakes as an intern, like end of the world kind of thing for me. But looking back, I can promise you that we're all human beings. They know your first year, they know you're likely to make mistakes, which is okay. Just it's hard, it's easy said than done. But at the end of the day, keep in mind that you are a doctor now. Well, you will be once you graduate. And you will learn. It's a steep learning curve the first year. And you eventually get your confidence and you will see yourself that everything you didn't need to study and study as much as you thought you needed to, and you don't need to beat yourself about it.
Thank you again for all of that input. I guess at this point, those are all the major topics that I wanted to cover. So at this point going forward, we could open up the floor to any of the other participants. Doesn't matter what year of medical school or what point of your training you're at. If you have any specific questions for the 3 residents that we have, we could open the floor up to you. And if not, if any of the residents have any other pointers or tips for any current 4th years or any rising 4th years who are just kind of maybe revving up, starting their application or thoughts about their application process, we could just kind of open it up generally.
Got a quick question. So this is coming from a 2nd year medical student, so a little earlier in the process. And I just wanted to see if any of you had any insights in what you would have done differently or things you would have wished you had gone into to get involved with, opportunities you wish you'd followed, just to kind of help make that transition into residency easier. Or if you're sitting on, I know you guys are probably on the other side where you're like gauging new potential residents to come join your teams, or will be shortly. What are you looking for them and for your own teams?
So hoping that you will stick with path of psychiatry. The biggest thing that I recommend, even for 4th years right now, is how to talk to patients. It is, you may think that, I have done it for the last 2 years. I think I'm good with it. It's much different when you become a resident. I feel like med students are often checking the box. Are you feeling depressed? Are you getting enough sleep? Are you eating enough? Have you lost weight or gained weight? Those are kind of like checks box, but that, for depression, but depression is different for each patient. So talking to patient like a human rather than a patient is a skill that you learn through practice. So whatever months you have left as a 4th year and as a for 2nd year, you still have fresh 2 years to kind of practice and refine that skill. And sure, you could be, even if you go IM or surgery, whatever you choose, patient bond, the rapport you build with them is one of the biggest thing will make you or break you. There is even a data how physicians get sued just because they weren't nice to their patient. So you could make a mistake with that patient, but if you're really nice and the patient loves you, they may forgive you. So that's just one kind of, benefits of having that skills. The second is kind of, I don't mean to, say like in a way to check boxes, but this is a game that you have to play in order to match. You got to know how the system works, then you got to play the system since we can't fight it. So what's the number one thing that you need to get an interview? To match, you got to have interviews. And to have interviews, you got to meet the cutoffs. Number 1, board score. Number 2, you got to have those number of research experience, volunteering experience. So you got to get those numbers up. Presentations, you got to get those numbers up. From my experience, I felt like once I made it through the interview process, they didn't even ask me like, oh, what was this research about? A couple of programs, but not majority of them. Or what was that thing about? They just pretty much looked at my personal statement, and every single program looked at my personal statement and they asked something about my personal statement. And all I had on my personal statement is a story. what happened in my life that made me want to choose psychiatry. What am I going to do as a resident? And what am I going to do as a physician once I become, how I'm going to contribute to the field that I'm picking. So those things, so in your case, get the numbers up for any research, whether it be meta-analysis, you're helping someone, presentation also fall under your research number when it tallies up on your ERAS application. Get your numbers of volunteering anywhere. Volunteering doesn't matter. You can use any research, any volunteering. At the end of the day, even if it's surgery, you can explain that as, hey, this was a learning opportunity for me, so I took it, and this is what I learned from it. But that because it was an opportunity, so I took it, nothing because I was interested in surgery or stuff like that. So play the system. And second biggest thing in psychiatry is building bond with your patients. So learning to talk to patients is one of the skills that I recommend.
Yeah, for me, yeah, I think those points are you know, like important. You know, I think it's, you know, beneficial for you guys because now that step one is you know, I guess sort of not graded, it's really just pass fail. That's a huge, you know, thing for you guys because that's what they really emphasize so much during the time that we were applying. So now that it's, and you know, it was annoying because that was just like basic sciences. It didn't at all correlate with you know, how well you would do in residency, like, or like, you know, how like well you would do like as a doctor in general. So that's, you know, like a nice thing that you guys don't have to worry too much about. Of course, you know, they're going to replace it with step 2 CK, just because they need a number to cut off, because like I said, they're going through 1,000 applications. They need some easy way to sort through them or to screen them. So it's going to be, you know, of course, more emphasis on that, and that'll be the new step 1, I feel. So, you know, definitely try to go as hard as you can for that test, and you know, try to make sure that you get a number that you're comfortable with, so that you don't have to stress too much during the application process. You know, fortunately, that's like something that really helped me, to be honest. When, you know, I was applying, I knew that I would make most cutoffs. I felt comfortable in the amount of places I applied to. I didn't have to apply to too many. And that was literally based off of just one grade on just one test. And it was ridiculous, you know, how much how much weight that carries. So yeah, definitely go hard for CK. And I think, you know, like, since it's good that, you know, you Daniel, you asked the question as a second year, if you're really confident about going to psychiatry, that's really cool, because then you could sort of, you know, like meld your application starting now and get involved in, you know, psychiatry stuff. That's what programs like to see. So, you know, getting involved in PsychSIGN, if you're interested in research, you could do that. For me in general, you know, and I have aspirations to maybe later become a program director. But even, you know, as a resident interviewing now, what I do like to see is, first of all, you know, that you have a passion, I guess, something that you specifically care about, whether it's in psychiatry or even outside of, you know, like academics, or maybe if you're able to tie the two together, because a lot of times they, in general, when we're reviewing applications, we try to get a sense of who you are. Who is this guy? What do they care about? How can I define them sort of really easily in just a sentence? And, you know, it's annoying, but I feel like it's something that does happen. And with that, you know, they could further try to see how they could help you further along your career, you know, give you mentors and so forth. But, you know, one thing, of course, you know, that I'm looking for is like just a chill person, you know, like when I'm in my interviews or interviewing someone, I don't want to see someone who's crazy high strung, crazy nervous, and I don't know, mean or whatever. You know, I want to like a chill guy or person in general, who, you know, like supports other people, who's nice, who cares about what they're doing, and also just has a balance in life, that they do things outside of academics, to not sort of stress themselves out in the long run. So yeah, I think all those things are overall really important to think about, maybe even, in the beginning of your career as even a second year.
Yeah, I think the only thing I would add to that is, if you're not sure that you want to do psych yet, if you're not sure where you want to end up, that's totally fine. You have lots of time, and just use this these next, or at least the next year and a half or so, just to have those interesting opportunities and try a variety of things, because after you finish med school and get into residency, your access to some of those experiences is going to narrow and narrow. And so even if you think that you're 90% sure that you want to do X, just use the opportunity to explore a little bit and do some things that are kind of intriguing to you.
Thank you all so much. Hi, can you hear me? Perfect. My name's Andrew. I'm over at Reno, UNR. I think my biggest question, since I'm a third year, kind of preparing for this whole away rotation and preparing my personal statement and then eventually getting on with those interviews, is kind of advocating for myself. I feel like I'm a pretty quiet person when it comes to in-person communication, if that makes sense. So when it comes to like emailing or even writing emails, I feel like I can easily kind of blend in with the crowd. But when I'm in person, I have a good time and I connect well with people. I'm wondering, I don't know if there's any pointers that anyone has, or how not to get kind of lost in the process as like an applicant, one of many applicants.
Yeah, I think it's tricky because you hear you need to make sure that you tick all the right boxes. You need to make sure that you have all the right experience, which is absolutely true. And at the same time, we want you to be an interesting, well-rounded person. So it can be hard to capture all of that in written applications. I think to some extent, those things will speak for themselves. If whether it's your step scores or the experiences that you've had throughout residency, like when you actually go on, or med school rather, when you actually go onto the application system, I mean, there's the capacity to put in a lot of information, and so it might be reassuring that a lot of those a lot of what is going to get you through those first couple of barriers to get you to the interview is going to be just kind of the on paper things. It's not going to be how flashy you make those things, although you should try to make sure that that you are intentful when you kind of go through the written part of the application. And I think as far as actually getting you that interview seat, a lot of those the things that programs are going to look for are going to be the things that are just kind of numbers or more translatable, not in person. And then when you get to the interview, you're able to show people a little bit more about yourself, kind of draw them in at that time.
So to add, if you're going for an AI to a program that you're interested in, I'll probably do some networking. This is where that talking to a patient, building rapport skill also comes in addition to having a good teamwork skills, because when you are acting as an AI or acting intern, you are going to be working with other residents who are also working there already. At least for the program that I worked at, they definitely asked the residents that I worked with how it was working with me. And we do that here as well at my program. So that kind of shows how well do you gel with new people that you have never worked before. because that's what it's going to be. You're going to be working with a number of residents who just came from all over the country in your class. And then all those new people are going to be working with other new people, PGY 2, 3, and 4s that you never worked with. And then every rotation, you're going to be meeting with new nursing staffs, new social workers, everyone that you're going to be working with. So how you work in a team and how you socialize, interact with your peers is a big thing. You could be, I don't know, you could have staff of 272, you could have a breaking 5 million publications, but if you're an asshole, then I'm not going to put you on number one, because I want to know that if there are 3 residents in my team and 1 upper level, and if someone is sick, I want to know that you're the guy who's like, okay, it's okay, he's sick, we got the patient, we'll take care of his patient, and not going sour about picking up additional 3 people for your teammates. So teamwork and how you interact with your residents is a big thing. They'll probably remember you by that as well. They'll be like, well, he had a little bit of low step score, or he may not have as many research, but he was really genuine about teamwork, and he was really genuinely cared about patients. So I'd rather have him on my team. So.
Yeah, I think in general, you know, like we, I guess, keep talking about playing the game is kind of like important. So just, you know, like in general, just like human nature, what do people, what I guess sort of piques people's interest? I feel like it's, you know, mostly 2 things: having something, I guess, pretty unique about you, something that maybe you're interested in, or something that you do that might catch someone's eye, even if it's written out in an email, can really like help remember you, I guess. You know, whether it's like unconventional or not. You know, for me, I think, you know, I had 2 things on my application that I felt like really at least stood out somewhat. But it was because I was actually interested in those things. So I was confident in sort of, you know, sending off that information. So I was really interested in technology, and I still am, and psychiatry, with like virtual reality therapy, AR, like a bunch of things. So that was something I think that, you know, like, well, people were like, oh, you know, what is this? You know, this is something interesting. And another thing was I really was, you know, involved in leadership, and I wanted to go further. Like I said, I was interested in becoming a program director, or at least a APD, so or associate program director. So things like that, you know, can definitely like catch someone's eye, I think, and help you. You know, I sort of get in the groove, in the loop, in terms of, you know, like getting that initial interest in you. And that's to say, you know, you don't have to do that, and you, especially if you don't like, you know, exactly what you want to do, you don't have to make something up to be like, oh, wow, I'm unique, whatever. That doesn't matter. Another thing you could do is people really like to be fluffed up, I think. People really like to see that you've done your research, and that you're interested in what they're interested in, especially researchers. So if you look up someone's research and like ask them about their paper, they're gonna be like, whoa, this guy's amazing, I love them. I think that's something that's you could do, you know, if you wanted to. And yeah, you know, like sort of it goes along with like just like put it in work to like figure out what a program is like, and what each individual person in the leadership is like, and really trying to fluff them up and get close, get comfortable with them, and so forth. I think that's something that can get you sort of an in terms of sparking that in applicant.
Yeah, to add, as since you're a 3rd year, I would also recommend trying to reach out to the programs that you're interested in. It's a little bit unorthodox, and I don't know if you have time or not, but I definitely reached out to many program directors in my 3rd year, had Zoom meetings with them, talked about the things that I was really interested in, genuinely interested in their programs. For example, telepsych, I was interested in that. I was interested in therapy. So we would talk about things that the program director, like, how did the telepsych come about? What are you guys doing so far? What are the limitations of your program? How are you guys fixing those limitations? So things like that, show genuine interest and start reaching out so that they have name, they have a face with your name when you submit an application, they'll probably remember you. That's if you really want to go there. I mean, don't invest your time in there just for the sake of matching. I feel like if you're a decent applicant, you will match somewhere. But if you want to go somewhere specific, start targeting the program now.
Thank you so much for all that. I kind of gave a hard question. I got a lot of great answers. So thank you.
If we don't have any other questions,
I have a question. Sorry.
Yeah, go for it.
All right. My name is Painting. I'm a second-year medical student. First of all, thanks to all of you guys for being here. I just have a question regarding the type of programs that you guys are ranking. And so I know from a very limited knowledge, there is community programs and there's research programs, like the teaching hospitals and stuff. So does community programs and, the teaching programs practice very differently, and do you approach them differently as well?
But I think in general, I think, overall, there's definitely a good amount of academic programs or quote unquote research programs that do a lot of community-based work. So if you're interested in the community, and you want to get involved, but you also really like an academic hospital, it's fine to apply to that place, because they'll more likely than not have those opportunities available for you to work in sort of more a community-based location, and so forth. And that's coming from like a New York area, like New York City, basically, where in general, like somewhere like Manhattan is an area of like higher socioeconomic status, but there's definitely going to be those pockets where you can have those like smaller hospitals who take care of people of lower socioeconomic status.
Yeah, I think it's kind of hard to say, because we can only kind of speak to our own experiences. So for me, I'm in a community-based program that's affiliated with UCLA. So I work in a community hospital, safety net hospital. So very clinically focused. I mean, we have didactics and everything that any program needs to have per ACGME. But certainly, I would say that the research is definitely a soft spot in the program. And it's not to say that you can't, if you're really interested in research and really motivated, then you can certainly do research. But it's not necessarily going to fall to you in the same way that it might in a more research focused, more academic focused program. I think at the end of the day, kind of figuring out, and in terms of figuring out what where you want to kind of prioritize, thinking about, are you somebody that's going to want to continue in academia, or are you somebody that's really research oriented? All those things would pretty obviously draw you towards a more academic program. And then, if there's a specific population of patients that you want to work with, then, I think you can get that at any, at a program, regardless of whether it's more community focused or more academic focused. But I think it's just a part of kind of figuring out what your priorities are and what you want to use residency as a stepping stone towards.
Yeah, I think it's overall like a little bit more emphasized than it needs to be. Because, my place is more of an academic place. It's really research focused, but like the majority of my class, they don't care about research. They're not going to do it. You know, it's something that my program directors like to see, I guess. But even in, you know, like in the application process, it doesn't really matter, at least for my program, like the numbers, quote unquote, of like publications and stuff. And it doesn't really matter for them, like how much research you do here, as long as, you know, like you're you know, meeting the standard, you're doing what you're supposed to in terms of, you know, like clinical work. Research is more of like an add-on like type of thing, and it's like, oh, you know, like you don't have to do it, but it'd be cool if you did type of thing.
Yeah, like Brian and Tyler said earlier, it more depends. It's not so much about, you know, how you approach your patient and community care versus research academia. It's more about like, I think it's more on the patient exposure you get in your residency, whichever program you go to. Everyone is going to have, each rotation is going to have like pockets of different demographics in your patient population. For example, here on one of we have multiple hospital system here, and we rotate in each system. So one hospital that I will go to, they have mostly chronic psychosis. So pretty much not very high functioning. Then another hospital I go to, they have a lot of high functioning patients with mood disorders. Then we also have affiliation with the Central State Hospital, where they have just chronic and very severe mental illness, some dual diagnoses as well. So I feel like whether you go to community versus research, but it's more important to have exposure to each demographics, so that when you do finish your residency and go to wherever you want to go for work, you know how to approach each patient type. Because sure, you can have whatever diagnosed, but then you also have to worry about the socioeconomics. You know, do they have access to the medication that they need? Can they get those injections? Who's going to take them to the clinics? So things like that. The more exposure you get to different patient population, the better you'll end up as a psychiatrist.
Yeah, thanks for the insights. I really appreciate it.
Any other last minute questions before we wrap everything up? Okay, on that note, I want to thank everyone who came today for participating and listening to the 3 residents that we had. And I also want to thank the residents as well for all of the input that they shared with us and all the insight as well. So I hope you all have a great evening, and thank you for coming. Bye.
Thank you all so much.
Thank you so much.
Thanks, everyone.